The testing facility we have is a very strong one compared to other European countries, actually. Our testing system has been meeting demand. We're over 100,000 per week testing capacity in PCR. It's quite a strong testing system, and we're a permanent workforce is being recruited. So I think there's been unfair criticism of the HSE and the work it has done over the summer in building up our testing capacity. We're testing far more people now than we did in the earlier phase of the pandemic, far more. And that's not been given any, in my view, genuine or acknowledgement. That is a fact. No, but there's a resurgence all over Europe. The virus doesn't lie quiet. The virus will thrive wherever you have congregation. And the country opened up during the summer period. It opened up across Europe. Some countries opened up earlier than we did. And that had to happen too, by the way, because psychologically you cannot keep people locked up for a prolonged period of time. So there's that to me had to happen. In other words, the summer reopening. So, and then the virus has taken root and is spreading again. And as long as we don't have a vaccine, and until we get a vaccine, societies and countries will be grappling with this issue of suppression of the virus, and unless we arrive at a balance where over a period of time you can keep it suppressed, then we're going to have continuing challenges. I think the central message I would give is that if we all reduce our social contacts, if we all behave as if we have the virus, that is the most effective way of stopping the spread of the virus itself. That's it. I mean, and I think that is key. In terms of the all-island, we've worked hard to maintain coordination, and our two chief medical officers have been in contact, both the Northern Ireland CMO and the CMO in the Republic. And likewise, the Ministers for Health, Robin Swan and Stephen Donnelly, have been in contact. I've been in contact with Arlene Foster and Michelle O'Neill. But they are two different jurisdictions with two different public health systems. That needs to be acknowledged, and sometimes people speak very simplistically about it, as if it's a matter of switching on a light switch and saying we'll have one system. And because of the politics involved, it is sensitive, and there is no point in pretending that it's not sensitive. It is. But we will continue to work to get as close a harmonious position as we can. But the UK position, which Northern Ireland has been more focused towards, has not always gone along with the kind of more severe restrictions that we've adopted here. That said, I will be engaged again with the leaders in the north, and both administrations will continue to cooperate and engage respectfully to see can we get the closest possible coordination. We did achieve it when we brought Donegal to level 3. Their Easter band came to something that approximated to level 3 at the time because of the high numbers on both sides of the border. But let's be aware of the sensitivities. We're not all blind to the sensitivities of politics in the north. And I think it's overly simplistic for some to try and ignore those political realities.
So have you any words for the Irish people facing these restrictions?
Well, I think what's important is that our clear priorities are to protect people, to protect the most vulnerable, to protect the non-COVID health services, to keep children at school, and to keep the economy going insofar as we possibly can, and to underpin people's incomes and to keep enterprise viable. That's been the challenge. And as a country, we have managed this, in my view, relatively speaking, quite well over since it began, because this is unprecedented. We're now facing another phase of this, and we're going to deal with it again comprehensively. And I'd say to the people, we must all just reflect on our own individual behaviours and collectively reduce congregation, reduce your social contacts, behave as if you have the virus, and that's the best way to reduce the spread of this virus. Thank you very much.
Thank you.